I am Dr. Mandeep Malhotra. I am a head and neck and breast oncoplastic surgeon. I am the clinical lead for the breast center at CK Hospital for Women at Gurgaon, and I am also the departmental head for head and neck and breast oncoplasty at Fortis Hospital for Sunpunch. My training comprises of surgical oncology from All India Institute of Medical Sciences. Then I did my head and neck and microvascular training from Mazumder Shaw Cancer Centre at Bangalore. My breast oncoplasty fellowship was from St. Andrews, United Kingdom. So our motto for breast surgery is actually surviving breast cancer without breast is battle half won. Therefore, apart from routine mastectomies, we have one of the best centers for breast conservative surgery, oncoplastic breast preservation surgery, mastectomy with primary reconstruction and secondary reconstructions for patients who have already undergone mastectomy. We are one of the first teams in this part of the world to do a prophylactic mastectomy for BRCA positive women. So in our breast center, we lay a great emphasis on prevention and screening. With our radiology colleagues, we have set up a dedicated breast cancer screening program to detect the cancer early and to save lives. And we have partners with the breast labs across the globe for BRCA testing and BRCA detection. We have partnered with the best labs across the globe for the testing of BRCA, that is the breast-related gene which causes the breast and ovarian cancers which run in the families. In head and neck surgery also our emphasis is to provide adequate surgical resections with minimal functional and cosmetic morbidity. For example, in an oral cancer surgery, if the jawbone has to be removed, the jawbone is removed and we are able to simultaneously reconstruct the jawbone using the bone from the foot with the technique of microsurgery. So the patient ends up with minimal facial deformity even after an advanced cancer resections. Also, we are one of the few teams across the globe who are competent and proficient enough to embark upon open skull-based resections for advanced or recurrent cancers of tongue, maxilla, larynx, that is voice box, throat, that is posterior part of the our feeding tube and tongue, and also the surgical resections for cancers or tumors of the airway, that is trachea. So for thyroid cancer surgeries or thyroid surgeries, we are also one of the few centers in this part of the world who perform thyroid surgeries through minimal access or robotic methods. That is, the patient doesn't end up having scar in the neck. The surgery is performed through endoscopic or robotic methods through the axilla or posterior part of the neck. At CK Hospital now we have a dedicated breast cancer unit and head and neck cancer services. So if any of you who needs any kind of help in a breast cancer treatment or a head and neck or a thyroid or a parotid cancer or even a recurrent head and neck or a tongue cancer, we are more than happy to help you out.